So I will be starting my 2 minutes time.
Okay.
Started 2 minutes time. Okay, I'm hello, I am Dr. Prajakta, one of the part 3 exam candidate, and I am ready for the structure discussion.
Yeah, you're welcome. Can you summarize the case?
Yeah, so here my patient is 42-year-old Mrs. White presented to the emergency department with symptoms of acute abdominal pain which is worsened and not responded to codeine, which was prescribed to her by the GP. These symptoms are associated with fever, nausea, vomiting, diarrhea. Apart from that, she's having a positive history of intrauterine contraceptive device, which was inserted 3 years back, and her menstrual cycle is regular, which is and last menstrual period was 3 week back. So
Okay.
no other significant history is here as of now.
What do you want to know from as information gathering?
Okay, so in this case, the patients, as I'm suspecting a case of initial sepsis, looking at her symptoms and observations. So here, my initial informations, most of the information has been given here. Still, would like to take few details regarding her bladder symptoms, urinary symptoms, vaginal discharge, bowel symptoms has been mentioned here, and allergy. Because if I'm prescribing her any antibiotics, I need to know about the allergy status.
Hmm.
Uh, any medications currently she is on, and any other comorbidity, although it has been mentioned that she is medically fit. Along with that, I would like to take a detailed examination for abdominal symptoms, abdominal examination, and per speculum per vaginal examination in the presence of saffron to see whether there are any pain, mass, any tenderness, any swelling, uh, guarding rigidities, bowel sounds, per speculum per vaginal examinations to confirm my abdominal examination to see whether there are any cervical excitation, pain, size of the uterus, and any adnexal pathology.
Okay.
Uh,
What is,
with Okay, can I send the blood investigations or
initial investigations?
yeah,
What do
in
you want? Hmm. Joe.
yes, with these symptoms, I would like to offer this case admission in the emergency department as of now. Would like to take a CRMA approach for this patient,
So
and
one minute. Shall I tell the examination findings? We have finished examination. The
Yeah.
examination reveals a large abdominal pelvic mass, a very tender abdomen, and if she has got guarding rigidity, no cervical excitation, no offensive discharge, her urine pregnancy test is negative. And what is your next immediate investigations and management will you do?
Okay. So this examination findings are suggestive of some
Mm,
pelvic or intra-abdominal pathology. Mostly in view of the current symptoms, it could be a tubo-ovarian abscess. Although we need to do certain other investigations to rule out any ovarian pathology. Looking at her symptoms, the initial management will be activation of CRMA protocols, where I will take a help of my call for help, my consultant, physician, microbiologist initially, and admit this patient in HDU under consultant and physician care.
mm,
From there, initial resuscitation will be offered to this patient. Uh, Antibiotics brought.
mm,
I would like to offer this case oxygen, 15 liter, 100%. 15 liter per minute. Followed by that, I would like to put a wide bore cannula, collect
mm,
baseline blood investigation, especially which will give me idea about infection, full blood count, CRP, serum lactate, blood culture, urine routine, swabs. Ultrasound has already been completed. So
mm,
LFT, RFT, serum electrolytes, these are the investigation of choice what I would like to do here. 3 weeks back, she had a LMP, so urine pregnancy test I may not be offering her at present. And with this, I would like to start her on broad spectrum antibiotics along with uh, rapid hydration by activating sepsis 6 protocol bundle and
mm.
catheterization to keep a watch on her input output.
Okay. Her ultrasound scan shows a large lip-sided pelvic mass of mixed ecogensity measuring 12 into 10 into 9 centimeter, separate from the normal uterus, which
Okay.
contains IUCD, a
Yeah.
small volume of free fluid seen in the pelvis.
Yeah.
Based on
So
this observations, and you can look at the chart also, and the result investigations show there is a C reactive protein is elevated, white cell count elevated.
okay.
So what would you do next?
Yeah, so this confirms the diagnosis of sepsis.
Mm,
Here, the first will be
mm,
continuation of the initial line of management along with removal of the copper coil.
mm,
Since patient is in sepsis, watch for a conservative line of management. But since the mass is quite big and patient is symptomatically deteriorating, here I would like to take a surgical call by
mm,
discussing this case with my consultant,
mm,
uh, and surgical line of approach will be decided for this case. So surgical line of care management will be discussed with the patient and her relatives. Informed consent will be taken. Patient will be shifted to theater. Consultant anesthetist will be informed and called upon. WHO safety checklist will be followed up. IV
mm,
antibiotics and VT risk assessment will be done for this case, and surgical exploration by laparotomy will be done. Removal of the TO mass, if there is any abscess, will be done. Utmost care will be taken to prevent any injury to nearby organ. A thorough lavage wash will be given, and procedure will be completed. The sample will be sent for microbiological testing and HPR also. Documentation will be completed in this case.
okay. How will you treat the patient post-operatively?
Yeah. So once the procedure has been completed, samples has been sent and the signed off has been completed for this patient. Proper documentation, writing of the operative notes, and shifting this patient to a high dependency unit where she will be monitored on MEOS charts, IV fluids, catheter, means input output will be monitored. Continue broad spectrum antibiotics and analgesics will be given to this patient. Hereafter, patient will be asked or encouraged to mobilize early to prevent the risk of thromboembolysis. Once the patient started mobilizing, we can consider, and criteria has been made. Patient can be considered for discharge with information and communication to the primary care. Uh, since the patient was having a TO mass, we need to follow up with the swab reports. Alternative contraceptions will be discussed, and if swabs are positive for any sexually transmitted infection, patient will be referred to the gum clinic. Once the patient will be discharged on broad spectrum antibiotics, the follow up instructions will be given with 24-hour contact details and when needs to communicate to the primary services. So, all these will be offered to the patient. Patient will be provided with patient information leaflet, and debriefing of the patient will be done once patient will be uh, mobile. Hello? Hello? Anything else, ma'am? Do I need to say anything else?